Hey, so my name is Audra Canoy. Today I'm going to be doing my in-service on lab values and end-stage renal disease. I chose this because while I was in my renal rotation, the way these labs work together and what they mean was a little bit difficult to understand. So hopefully I can explain it well in this PowerPoint. So the first lab I want to talk about is phosphorus. So what is phosphorus? It is a mineral found in the body. About 85% of the phosphorus in the body is located in your bones. It is the body's next most abundant mineral after calcium. And the body uses phosphorus to form strong bones and teeth, maintain a normal pH balance, get oxygen to tissues, create energy, change protein, fat, and carbohydrate into energy, develop connective tissues and organs, move muscles, produce hormones, and use B vitamins. So, how does the body get phosphorus? It is absorbed in the small intestines and stored in the bones. Healthy kidneys get rid of the extra amounts not needed in the body. Phosphorus is found naturally in many foods and is added to a lot of prepared and processed foods for shelf stability. So, how does phosphorus interact with calcium, vitamin D, and the parathyroid hormone or PTH? So, phosphorus and calcium work together to create healthy bones and teeth. The kidneys are responsible for keeping these two minerals in balance in the blood. The kidneys are also responsible for turning vitamin D into its active hormone form, which helps increase calcium absorption from the intestines into the blood. When the calcium level in the blood is low, the parathyroid glands make more PTH, which causes calcium to be pulled from the bone into the blood. Too much PTH can cause bones to become weak and break easily, which is called osteodystrophy. So, how is phosphorus connected to bone disease? Unhealthy kidneys are no longer able to remove phosphorus from the blood and get rid of the excess in urine. High levels of phosphorus is a problem for people with stage 4 or stage 5 kidney disease because high levels in the blood can cause bone and heart problems that lead to hospital stays and, in some cases, death. Too much PTH to be released, which weakens the bones. Low blood calcium, which causes calcium to be taken from the bones. And calcification, which is the hardening of tissues when phosphorus and calcium form hard deposits in the heart, arteries, joints, skin, or lungs that can be painful and lead to serious health problems. What medications are used to manage phosphorus? So primarily it's phosphate binders, and also just changing your diet. But phosphate binders are taken before meals and prevent the body from absorbing phosphorus from the food that they eat. So they'll help pass the excess phosphorus out of the body into the stool, reducing the amount of phosphorus that actually gets into the blood. So one problem that I've noticed with these is that patients will often have to take like 3 or 4, sometimes even up to 6 of these with every meal. And since the pills are pretty large, a lot of people struggle with being consistent with this medication because it's difficult to remember to take something before you eat. So next is calcium. What is calcium used for? It is used to form strong bones and teeth, help muscles contract and relax for normal movement, transmit nerve impulses, make blood clot normally, regulate cell secretions, cell divisions, and cell multiplication, and assist with enzyme reactions. Um, ca- how does the body get calcium? It is supplied in the food we eat and from calcium supplements. Vitamin D and the parathyroid hormone help regulate how much calcium is absorbed and how much calcium the kidneys eliminate. So, how much calcium does a person with kidney disease need? CKD causes imbalances in bone metabolism and increases the risk of developing renal osteodystrophy. These imbalances also cause calcium to deposit in the blood vessels and contribute to heart disease. According to the National Kidney Foundation, total calcium intake for people with renal disease should not be greater than 2,000 milligrams daily. Up next is the parathyroid hormone. So, what is it? It is also called PTH and controls how much calcium is in your blood and within your bones. The release of PTH is turned on and off depending on the levels of calcium in your blood. For example, if the blood level of calcium becomes low, the parathyroid glands will release more PTH. And this causes the bones to release calcium, and then the blood calcium level will rise. So, what is secondary hyperparathyroidism? This occurs when the parathyroid glands become enlarged and release too much PTH, causing a high blood level of PTH. So some of the reasons that this happens in patients with kidney disease is because the kidneys cannot make active vitamin D, which is needed to absorb calcium. It happens to lower blood calcium levels. And secondary hyperparathyroidism can cause bone disease. It can also cause calcium to build up in tissues and organs such as the heart and blood vessels. So, how does secondary hyperparathyroidism cause bone disease? Your bones are in a constant state of change. There are cells that build new bone and cells that remove old bone. This process is known as bone turnover. If you have secondary hyperparathyroidism, bone turnover is high. This means that the cells that remove bone are working more quickly than the cells that build new bone, causing your bones to become weak and brittle. This can increase your chances of having bone pain and fractures. So there's several ways that this is treated. One way is through vitamin D supplements and vitamin D analogs. So you need active vitamin D to absorb calcium from your intestines into your blood. Without enough active vitamin D, your calcium levels drop and the parathyroid glands release too much PTH. So they want to make sure you're getting enough vitamin D. Another way is a medication called cinacalcet, and it acts directly on the parathyroid glands to lower blood PTH. It acts like calcium so that the body thinks that there's more calcium in the blood. It is a pill that you take once a day and is only for patients on dialysis. It can increase your chances of having low blood calcium levels. Another way is surgery. So, a parathyroidectomy is an operation that just removes the parathyroid glands. It's only for very severe cases of hyperparathyroidism that cannot be managed with medicine. And you also just want to control your blood phosphorus levels because since high blood phosphorus levels increase the release of PTH, it is important to keep your blood phosphorus in normal range using diet and phosphate binders. So next up is albumin. What is albumin? It is the most common protein found in the blood. It provides the body with the protein needed to both maintain growth and repair tissues. During a dialysis treatment, the albumin in your blood also helps with fluid removal. It helps pull extra fluid from swollen tissues back into the blood where it can then be removed with the dialyzer. So, what causes low albumin apart from not eating enough protein? So, inflammation and infection will cause an albumin level to drop. So, possible causes of infections include an infected access, an infected foot, decayed teeth, or infected gums, or a bladder infection. With peritoneal dialysis, protein loss can occur across the peritoneal membrane. So you really have to watch protein in patients receiving peritoneal dialysis. So, how is hypoalbuminemia treated in end-stage renal disease? Patients who have consistently low albumin levels are given liquid protein to take while they are being dialyzed. If they don't want this liquid protein, then they are encouraged to eat meat from animal sources. Anemia. So, anemia happens when your red blood cells are in short supply. Red blood cells carry oxygen from your lungs to all parts of your body, giving you the energy you need for your daily activities. So, some symptoms are like you look pale, feel tired, have little energy for your daily activities, have a poor appetite, have trouble sleeping, trouble thinking clearly, feel dizzy or have headaches, rapid heartbeat, feeling short of breath, feeling depressed. So, why do people with kidney disease tend to get anemia? So, the kidneys make an important hormone called erythropoietin, so EPO. Hormones are chemical messengers that travel to your tissues and organs to help you stay healthy. EPO tells your body when to make red blood cells. When you have kidney disease, your kidneys cannot make enough EPO. So this low EPO level causes your red blood cell count to drop and anemia to develop. Most people with kidney disease will develop anemia. It can happen early in the course of kidney disease and grows worse as kidneys fail and can no longer make EPO. So, how do you know if you have anemia? So, not everyone knows with anemia has those symptoms. So, if you have kidney disease, you should have a blood test to measure your hemoglobin levels at least once a year to check for anemia. At the dialysis clinic I was at, they would check every month their hemoglobin levels. So, hemoglobin is the part of red blood cells that carries oxygen throughout your body. If your hemoglobin is too low, it is likely you have anemia. In that case, your healthcare provider will check to find the exact cause of your anemia and plan a treatment that is right for you. This is just something extra I found while I was at that rotation because I really didn't understand before going in the difference like between hemodialysis and peritoneal. So like this shows you that like hemodialysis is external. It goes through something through the machine outside the body and then returns the blood back into the body, and then peritoneal is through the peritoneal cavity, and that dialysis goes in and then the excess comes out. So these are my references. Thanks for listening.